And so I titled this presentation today, Understanding Factors for Adolescent Gun Violence, a focus on adolescent brain development and community context. And as Fong mentioned, I am the co-director of this what's known as the CTRJJ, or the Center for Trauma Recovery and Juvenile Justice. And I see some of my CTRJJ colleagues on here as well. We are a CAT 2 center, and and so I will talk about some of the resources that I think that people on the call might be interested towards the end. But broadly, the CTRJJ, our mission is to support a comprehensive framework for developing, adopting, implementing, and sustaining evidence-based trauma-informed services for youth and families who are both in or at risk for a youth justice system involvement. And while we have other CAT 2 centers that have some juvenile justice interface as part of their overall portfolio, to my knowledge, the CTRJJ is the only CAT 2 center that is exclusively focusing on the youth justice space. And a little bit more about the presentation than for today. This is just replicating what was in the description, but what I hope to do in an hour's time is to provide everyone with an overview of some recent studies identifying both a combination of risk and protective factors that is associated with gun violence. And what you'll see in the presentation is that I'm actually going to make a differentiation between some of the research that is focusing on gun carrying and gun violence as well. And a take-home message is, while there's a lot of similarities, there's still some, I think, very important distinctions that the literature will draw around this distinction in the gun violence space. And more importantly, aside from just focusing on risk and protective factors, is I'd like to spend a little time thinking about this in the context of adolescent brain development, both from thinking about a system response, but also how this is informing justice system responses as well, and probably also the way that we really need to be thinking about prevention and intervention as well. Is one take-home message from today is that gun violence is not just a pure mental health problem, right? Is we really need to think about this as a public health crisis, really, that is impacting youth and families in our communities. And so with that, I'll also highlight the relevance of community context and peer effects to really help to better understand and to think about understanding this as a real complex problem. And then finally, I'd like to, because a lot of this is unfortunately is going to kind of sound very gloomish and doomish, right? From this perspective, but I'll try to end with providing some support for what I see as some promising community-based prevention and intervention efforts within the space as well. So as opposed to doing a full bio, et cetera, because, amongst colleagues here, I thought what I would do is just provide you a little bit more background in terms of acknowledge the work that I do and sort of the frames that I come from and approaching this work. And I think it's first really relevant to acknowledge that I approach this work from the perspective of a trained juvenile forensic psychologist with over 25 years of professional experience working within the youth justice system. And I've worn many hats from across these 25 years, combined roles as a faculty member, as a practitioner, as a researcher, as a consultant and trainer, focusing on youth justice system reform more broadly, and thinking about how do we balance effective and responsive services for youth and families, while also thinking about and acknowledging the relevance of public safety as well. And for over 15 years, I've been working towards more effective infusion of trauma-informed services within youth justice spaces, both through the Center for Trauma Recovery and Juvenile Justice and also other spaces that I work in as well. But I also engage in a private forensic practice, and increasingly within the past 8 years, I've conducted, unfortunately, too many evaluations of adolescents who have been charged with homicides that have involved gun violence and that have most often involved another peer and an adolescent as a victim as well. And so, with those acknowledgments, I'm primarily for my school colleagues here on the call. I thought it might be a little bit helpful to kind of, you know, set the stage and to do a little primer on historically and maybe contemporarily, if that's even a word, of looking at juvenile justice reforms. And so this comes from a summary by the National Campaign to Reform State Juvenile Justice Systems, and where we acknowledge that wave one, in terms of juvenile justice, was, coincided with the first establishment of a juvenile court in the late 1800s. And this was really anchored in a rehabilitative model, the recognizing that children are different from adults, and that they're worthy of protection in order to promote, positive and healthy futures. And that ushered in what is often known as a wave two reforms. And this was really anchored in some critical Supreme Court cases in the 1960s that really recognized for the first time that adolescents were persons under the Constitution for the purposes of important substantive and procedural due process rights in the context of a juvenile court adjudication. But with the second wave, there was still broadly this recognition of the aspirational goals of the rehabilitative model as being important for adolescents or juveniles when they're within the system, but also recognizes that as a social experiment, the courts at that time were not really doing a very good job of meeting that aspirational rehabilitation goal. Kids were actually being treated like criminals without the protections of the adult criminal justice system. And unfortunately, we stayed in that wave two era until around the 1980s. And of course, many of us are probably familiar with this. It was really a wave three era, sometimes referred to as the juvenile super predator area. Across the US, there was a rise in juvenile crime that ushered in across the country a whole range of punitive, get tough laws on juveniles. And this lasted up through what we might recognize as wave four. And wave four was really seen post 1995. The nation started to see a decrease in the amount of juveniles who were arrested and brought into formal court processing. Now, there were a number of other factors that influenced this as well, but wave four was essentially characterized by decreasing juvenile arrest rates, recognizing of the high costs associated with out-of-home or out-of-community placements, like residential placements or correctional placements as well. And importantly, and I'll be describing this momentarily, is that there was a series of three very important Supreme Court decisions that reinforce this categorical distinction between adolescents and adults for purposes of when adolescents were charged with serious and violent crimes, often involving homicides or gun-related crimes as well. And this really solidified a new constitutional framework that was grounded in developmental science that adolescents are categorically different from adults for purposes of harsh sentences. And as part of wave four reforms, what we've really seen is we've seen things like reduced use of incarceration and out-of-home placements, a general trend for state and local systems to treat kids as kids and not as adults, diverting more youth from the juvenile justice system entirely, working to try to ensure equal treatment and due process, and of course then balancing youth development, personal accountability, and public safety as well. I said I would talk a little bit about adolescent brain development, of course, and drawing on these important Supreme Court cases in the early 2000s, prominent forensic psychologists have really distilled that courts are recognizing that there are five or legally relevant hallmark features of adolescence, and they're reflected on this slide. We can think about them as first being decisional, sort of this recognition that adolescents as a class or as a group are more prone to engage in sensation seeking. They're more prone to engage in risk-taking behavior and engage in less sophisticated forms of judgment relative to adults. You can think about a dependency factor as being important. And this is really recognizing that both the family and the home context and also peer influences are very important and change over the course of adolescence. And these decisional and dependency characteristics really reflect and should help us to try to understand and contextualize when adolescents engage in behaviors that would violate the law. This risk-taking, this dependency, these characteristics should all help to sort of contextualize and help us to think about maybe some of the reasons, the hows and the whys that an adolescent might engage in this behavior. And more importantly, it's also a recognition of the rehabilitation potential for adolescents as well. This was very influential in these important Supreme Court cases, really recognizing is that the brains of adolescents are not yet fully mature, and therefore adolescence is a time period through maturation where there is also a greater possibility and the potential for a change as well. And with this, so there's also a recognition is that due to sensation seeking, risk taking, and poor judgment, that when adolescents do find themselves in the system, that they need some important buffers in relation to things like custodial interrogations by the police, or when they're asked to make important decisions when they're in a criminal court context about how to evaluate and making decisions about, say, for example, accepting a plea. Now, these authors all recognize that brain science research that undergirds these Supreme Court decisions, and that other courts have drawn on, really emphasizing the normative pattern or the typical pattern of adolescent brain development. And while the courts have often drawn a bright line distinction between adolescents and adults as a category, I think those of us from a developmental or a schools or an educational or a clinical psychology space, we know that immaturity and maturity are actually relative, right? And while there is likely variation in the maturational growth process, for individual adolescents as well, and while this categorical distinction that kind of makes sense as a group, we often grapple then with how mature is one 16-year-old relative to another 16-year-old, right? How mature is this 18-year-old? Who may on many levels look very comparable to like a 12 or 13-year-old from their cognitive maturity or their emotional maturity. And what I will say is that the courts really kind of grapple with this. But that being said, there are really five sort of overall research findings regarding youth and brain development and the implications for juvenile justice system involvement that are really summarized here from a report released by the National Conference of State Legislatures in 2023. The first is that adolescent brain development doesn't stop at 18, right? That it actually continues into the mid to late 20s as well. And that self-control is an important maturational characteristics for adolescents. This is related to the developing prefrontal cortex, where young people, because of this developing and the delays in the full maturation of the prefrontal cortex, young people take more risks. They're more likely to focus on peer relationships, as well. And this impacts the quality of their decision making. That adolescents and young adults need guidance and support in considering longer term consequences and in order to make more future oriented decisions. And subsequently, there's a recognition that this should lead to a focus on responses for incentives, right? And young people are particularly receptive to reward-based responses. And for the context of our discussion today, I think we got to recognize that both has good and bad components to it as well when we start thinking about trying to alter or shape adolescent behavior. If we can create reward-based responses that are meaningful to them, they're more likely to lean into those. But the don't do this is not very effective, right? Which is a common strategy used within the system. Or when their reward-based incentives are coming from negative peer group contexts as well, that may make it a little bit more challenging or resistant to change. And ultimately, we can think about then from all of these perspectives, a full recognition is that due to adolescent brain development and maturation, that conduct problems or the quote antisocial behavior or even the illegal behavior that adolescents will engage in, that the majority of youth actually outgrow their delinquent behavior, right? And only a small percentage will continue to commit and continue to engage in serious and violent conduct problems as an adult. So that's a very whirlwind tour. I normally give about a 2-hour presentation unpacking a lot of that, and I did it in about 10 minutes, right? But I think with this, though, we have to really think about the importance of context. Now, Larry Steinberg, now retired, very influential developmental psychologist, is credited with the statement is that cortex without context makes for very bad policy, right? And so how well any given adolescent brain functions is going to be dependent on multiple factors. Of course, the stage of development, childhood versus adolescence versus transition age youth or emerging adult is one of those characteristics. Then we want to think about environmental factors that can negatively impact both the structure and the functioning of the adolescent brain as well. Or in other words, it may change the shape of that brain maturation trajectory. These are things we're all familiar with, stress. And what I would include within that stress is including violence exposure, within that as well. Abuse and neglect, traumatic brain injury, and substance use. All of these are known environmental factors. It's certainly not an exhaustive list, but it's an important list of ones that we would recognize as shaping overall brain maturity. And really, the presence of any of these factors can increase the probability of reduced executive functioning in a maturing prefrontal cortex. And it can actually exacerbate things like the poor planning, the impulse control, the decision making, and the less mature forms of reasoning. So if that's sort of a tour through the system, and if we recognize that there have been a lot of really positive reforms, I think I also want to give you a snapshot of what's happening in the system right now. Very, very busy slides here, but let me try to provide you a summary, right? I'm going to give you sort of 2 snapshots on trends and characteristics of juvenile court cases, for the year 2022. So what you can see what might be reflected here up in that top corner is actually nationally, juvenile court caseloads have continued to drop. They peaked in 1990s and they've been leveling off up through 2022. Now that we saw a slight increase in 2021 and going into 2022 during the COVID-19 pandemic, but this is the general trend nationally. And the proportion of cases by age group has actually remained remarkably consistent over a 20-year time period, with more older adolescents being formally in the system. We know that there's a gender difference in juvenile court cases where females actually represent only about 30% of juvenile court cases. And beginning in 2014, we've actually seen, while there's been an overall national decrease, we've actually seen a rise in person-related offenses. And person-related offenses are going to include offenses like robberies or armed robberies and homicides as well, right? And though, despite what we may hear a little bit in the press, probation, community supervision or probation remains the most common disposition. But while we've seen so many positive trends, racial and ethnic disparities in juvenile court processing has remained a pernicious problem. right? Since 2005, referral rates among Black youth are more than twice the rates of other racial and ethnic groups. And delinquency cases involving white youth are actually more likely to be diverted from the system and least likely to end up in out-of-court placements, like detention. And youth of color may more likely to end up in out-of-home placements. So all of this sounds like, some positive messages, et cetera. But sometimes these national trends don't really mirror some of the things that are happening at the local level. And so as we kind of recognize here is that this is just a bigger picture of these trends of what we're seeing in terms of rates of arrests of youth between the ages of 0 and 17, kind of showing that overall downward trend. But unfortunately, national rates sometimes don't mirror local reports. Let me share with you a couple of headlines. So this is a news story from Charlotte, North Carolina, that noted an increase in crimes in that jurisdiction. In Charlotte, North Carolina, were actually up over a 12-month time period. And so the report said, even with an overall drop in homicides, right, overall, that there was a 33% increase in juveniles who were suspects in homicides, and the number of underage victims of gun violence went up by 18% in Charlotte, North Carolina in 1 year. A news story from Baltimore. The Maryland Department of Juvenile Justice released research documenting a very concerning trend about youth violence in Maryland. It said that over the past 2 years, juvenile crime rate has begun to actually creep up, and now kids are far more likely to become not only perpetrators of gun violence, but targets of gun violence as well. And that the rate of juveniles being charged with murder and attempted murder had increased within Maryland over a 5-year time period. And I'm going to show you a little bit more about this, momentarily. But we also want to recognize that CDC data has really indicated that homicide is the leading cause of death for young persons below of young people, ages 10 to 24. On any given day, 12 young people are victims of homicide, and approximately 1,400 are treated in emergency departments for non-fatal assaultive injuries as well. And I think what's really interesting about this report is that it notes that the impact of youth violence is not the same across all communities and across youth within the communities as well. And it really links to that there are going to be different subgroups of adolescents that are proportionally, negatively impacted by gun violence in particular, and really highlights that there are risk and protective factors that we likely need to consider at the individual and the community level. So turning more specifically, I want to offer 5 facts for gun fatalities in the United States in 2022. Utilizing CDC data here, the authors of this report, noted in terms of fact number 1, over 48,000 people died from firearms in the United States in 2022. And that leads to 1 person who was killed by a gun every 11 minutes. Fact number 2, over 27,000 people died by firearm suicide. And this represented a 2.7% increase over just a 1-year time period. Fact number 3, firearms are the leading cause of death among children and teens, ages 1 to 17, and represent a 30% of all deaths that occurred among individuals aged 15 to 17. In fact number 4, Black youth had a homicide rate over 18 times higher than their white peers. And from 2013 to 2022, the death rate for Hispanic and Latino youth increased over twice as much as the rate for white youth as well. And fact number 5, over a 10-year period, the rate of Black youth gun suicide has tripled, and doubled for Hispanic and Latino youth, with the rate of firearm suicide for Black youth actually crossing over the rate for white youth and increasing 85% over a 4-year time period, right? And so I think any conversation around gun violence among adolescents, needs to reflect that adolescents are both perpetrators and victims of gun violence. And part of the conversation around gun violence is recognizing is that adolescents are just as likely, almost just as likely to turn a gun on themselves as they are to turn a gun on someone else as well. Now, what I'd like to do is I'm going to talk a little bit about, unpacking some of those risk and protective factors, thinking about first gun carrying through a social ecological approach. And I'm going to be pulling from a systematic literature review that was done with the citation here. And I'll talk about I think some of the important studies that they highlighted in this review. I think the first is that in a sample of 141 young adults, primarily Black, in this case, it's young adults living in what they called high burden neighborhoods. 17% reported carrying a handgun in the last 3 months, right? And 64% reported that if they weren't carrying, it would be very, very easy for them to obtain a handgun. And some common reasons for carrying guns that are reported by adolescents and young adults were to protect friends, right? Or to protect family members, or for that general sense of a need to feel safe in their communities, or to get back, or to get revenge at someone, or in retaliation for a particular event, or unfortunately to feel respected or to feel powerful. These were all common reasons that adolescents and young adults describe for gun carrying. And what is also recognized in this review is that witnessing and experiencing community violence is robustly associated with increased risk for gun carrying. And from a protective factor perspective, ethnic identity, or that sense of emotional and behavioral connectedness to one's ethnic identity, actually is showing in many studies as a moderating or a buffering or a potential protective effect, for gun carrying. But, with this, then things like lack of family, or excuse me, because we could look at this both as risk or protective. But from the protective standpoint, absence of family conflict, retention and connectedness to one school, and the presence of other forms of community assets actually moderates that association between experiencing community violence and handgun carrying as well. So what we can see here is that it's just giving us this sort of sense that the social ecological approach or model is important for thinking about this combination of risk and protective factors for gun carrying. But we'll unpack this a little bit more from the perspective of individual and peer level risk and protective factors for gun carrying as well. In a sample of over 200 adolescents, majority Black, 30% reported carrying a handgun, and 14% reported that they had friends that carried a handgun. And adolescents who carried reported a variety of different positive beliefs that were supportive of proactive aggression, right? Lower levels of beliefs against fighting, right? A less positive overall outlook, that sort of ties into that like short-term versus long-term consequences. But interestingly, that they would self-report a sense of more personal assets. And at the relationship level, having friends that carry a handgun unfortunately, is a very robust predictor of that adolescent carrying themselves as well. And interestingly, at the community level, personal or other social assets like, community resources, unfortunately, and a few studies have been shown not to actually buffer the risk of a friend's carrying on that adolescent carrying as well. Okay. And this, of course, raises some important concerns is that even in communities where there are some appropriate, and we could think about some protective community assets or family assets, having a peer that carries and the sharing of some common beliefs, amongst peers, that this is an appropriate community norm may actually override the buffering and protective effects that we may see from the family or from the community context as well. And so that's a little bit of a highlight around gun carrying. And what I'm going to do here is I'm going to draw on probably the largest longitudinal study of adolescents, that were involved in the juvenile justice system. It's known as the Pathways to Desistance study. And this was a study, it's a multi-site study in Philadelphia and Phoenix, longitudinal study of adolescents that were within juvenile court for a serious, typically violent offense. So over 1,300 adjudicated adolescents who were between 14 and 18 years old at the time that they entered the study. And then they were followed for 7 years, right? And so this is following them from adolescence into emerging adulthood. And the overall goal of this study was to really understand both patterns of persistence and desistance from antisocial behavior or crime, while also considering both the social context and the overall development, right? And if you're unfamiliar with this study, you can just Google the Pathways to Desistance study, and you will see that at this point, there's probably over 100 to 150 peer-reviewed publications that have emerged from this really important and seminal longitudinal study. But a number of those individual studies have looked at gun violence risk factors, risk and protective factors. And I'm going to summarize 4 studies here for you just real quickly. But what we can see from within the sample, across a series of different studies, that there's actually some important consistency in the types of risk factors that are emerging. And one take-home message here is that oftentimes the risk factors that we consider to be associated with delinquent behavior in general are also very predictive of gun violence and use of a firearm in a violent act. But it's not just common delinquency risk factors. There are other important and what I would call maybe some gun-specific risk factors as well. So an early study in 2020 looked at gun violence, particularly within males as well, and found, of course, just from what we were talking about, that, of course, carrying a gun is quite logically going to increase the likelihood that that gun might be used. Although rates of gun carrying across studies is always higher than the actual pulling and use of that gun as well. But substance use, and actually involved in drug selling is an important risk factor predicting gun violence. And once again, exposure to violence and gang membership were all risk factors identified here. But there were a series of protective factors that should lean into and thinking a little bit about some of that adolescent maturity. So a concern for others, having specific goals or aspirations or more long-term goals about work and family, engagement in some sort of religious or spiritual practice, and having at least 2 positive adult forms of support were all protective factors that reduce the risk of gun violence. In the Gonzalez and McNeil 2020, this was just looking at broad correlates of adolescent gun violence and more at the individual and peer level. These authors identified things like what we call moral disengagement and the presence of antisocial peer influence, substance use, and particular types of mental health factors and threat control override symptoms. Were all associated with gun violence. And then at the neighborhood level, just the overall density and rate of gun accessibility within the neighborhood is associated with gun violence. Rowan et al. Identified some other proximal factors for gun violence. Low future orientation, right? Perceived personal rewards that were associated with engaging in crime. And school and community disengagement, and the frequency of victimization and witnessing also gun violence, but also non-gun violence. in one's neighborhood was associated with gun violence. And finally, the last two studies looking at both individual and peer factors. Both of these studies just really reinforced it's that exposure to violence within communities is a robust predictor of both gun carrying and gun violence, with this effect being enhanced by other mental health and other like mental health difficulties, such as personal distress or self-regulation difficulties, and also peer delinquency as well. Now, I know that's a really rapid tour through this, but I do want to point, everyone here to another really great systematic review that really does a nice job of critically unpacking youth exposure to community gun violence and thinking about the implications of that, both as a public health problem, but then also as, leading for us to really thinking about points of prevention and intervention. And there were 5 broad themes I think that the authors really raised in this systematic review. The first is that there's really, across this literature, that despite what I was mentioning before, there's kind of lack of consensus on what range of experiences should constitute community gun violence exposure. Right? If witnessing and experiencing community violence and gun violence is an important risk factor, we need to have a better and a more intricate understanding of what that exposure means. And because the authors are really recognizing us as that studies are suggesting that community violence exposure and community violence exposure that is firearm related compared to other types of weapons seems to carry a different load of risk for young people. And this is sort of suggesting is that there are likely multiple dimensions of gun violence exposure that we need to consider across the social context. And that is also likely to have an impact as we start thinking about the differential impact on gun violence exposure across the different developmental stages. And that gun violence exposure, of course, probably uniquely contributes to cycles of community violence, through multiple pathways. And so this figure on the right really reflects the author's sort of considerations that we need to consider differential impacts of different types of gun violence exposure, right? And that there are probably likely important differences in levels of risk associated between indirect exposure and or knowledge of gun violence in one's community versus directly experiencing gun violence as well. And at the lowest level of this kind of pyramid, is that is sort of that notion of community level, and that gun violence exposure at community level is actually probably ripples across a young person's overall social ecology, right? And in other words, it's the author's recognition is that you don't need to directly experience or suffer the consequences. You don't need to experience the injury yourself from guns or directly witness it happening to others. Just hearing and seeing, the gunshots in one's neighborhood is likely to have an impact. And of course, research is also showing, and not surprisingly, that the next level up here would be that vicarious exposure. Geospatial analysis of community exposure to gun violence has found, of course, that the closer proximity that children live to gun violence is associated with worse mental health problems as well, right? And that quite logically, makes a lot of sense, right? We've known this for different sorts of traumatic event exposures, for decades, right? But geospatial analysis is showing that proximity effect is very important, as in relation to gun violence as well. And of course, then relational proximity. It's not just physical proximity, but it's the relational proximity is important. Youth who witness friends, family members, or people known to them being shot, differentially are impacted and will report higher rates of traumatic or of trauma reactions or diagnosable post-traumatic stress disorder. And of course, at the highest point of this figure, it's of course being a direct victim, of gun violence as well. And I'll return to this theme a little bit later, but the authors of this article really note that youth with repeated exposure to gun violence over longer periods of time are prone to then developing these normative beliefs about community violence. And then this may contribute to really adopting what they call the maladaptive cognitive framework for, for those acceptance of those community norms around gun violence as well. And unfortunately, I think what this also emerges to is it also then will come with a complex set of coping behaviors in response to gun violence as well. So some take-home points for this is from the data that I mentioned, I think we need to recognize that adolescents are both perpetrators and victims of gun violence in the United States, and it reflects that we need to consider a balanced approach and consider differential impacts by race and ethnicity, and as well as community context. And from the risk and protective factor studies that I summarized, there are many adolescent-specific risk factors identified in the literature for gun carrying and gun violence that are known. These are known delinquency risk factors, things like negative peer group affiliation, things like substance use, things like um, uh, you know, disengagement from schools and communities, and the adoption of a set of cognitive beliefs about the acceptance of violence as an appropriate way of solving problems or getting you something that you want. Is that these are all known risk factors that are also predictive of gun carrying and gun violence as well. However, what really emerges from this research is that it's witnessing and experiencing community violence has a pernicious and pervasive effect. And, especially gun violence factors that are proximal, to the youth, right, in terms of their individual characteristics and peer characteristics, are known risk factors for both gun carrying and gun violence as well. But then once we back out and think about those distal community level characteristics, I think it really reinforces that trauma-informed approaches are going to be critical to prevention and intervention. And so I can't just leave you with all this gloom and doom. I kind of want to summarize a bit of what we're seeing about some positive and promising approaches. And so this slide will summarize a couple of different systematic lit reviews and scoping papers that are focusing on community violence interventions with a few highlights. One thing that we're seeing, of course, and this is quite logical, as comes from just a descriptive case study published about 5 years ago, is the relevance of community violence or violence intervention specialists, i.e. the use of credible messengers, is now being recognized as a common ingredient to community violence reduction, intervention efforts. A systematic lit review covering 13 articles really identified some important frameworks for thinking about gun violence interventions. And what they're finding is when we think about what is being offered up in these models is a holistic public health approach as being absolutely necessary to address this problem. And it's not just a public health of taking that top-down perspective, it's really integrating that this requires community mobilization and engagement of the community as being partners in helping to try to address this problem. And hospital-based violence intervention programs, they're known in the literature as HVIPs. There have been 7 RCTs and 6 observational studies that are showing some promising effects on community violence intervention and reduction in gun violence. But unfortunately, these studies the authors really said that there's some methodological problems in these studies that really help to kind of point out to some needed improvements in the sophistication of this research as well. But a scoping review of other types of HVIPs showed really positive outcomes in terms of reduction of community violence risk factors, decreased re-injury among adolescents and young adults who had been a victim of gun violence as well. and overall decreased sort of criminal justice involvement, right? But the authors really point out is that there appears to be a trend for age-based effects. Here, really reinforcing is that we need to really think about age, and this overall brain maturation process is probably critical to help to inform the way that we're structuring interventions. So I'll conclude with a few other more promising approaches. And if I want to just take a step back and, if we if we move back from community violence reduction or community violence intervention programs, um, we know that school diversion programs are having a very, very positive impact. And so if you're not familiar with the Philadelphia Police School Diversion Program, at this point, I think that there are about 4 really good peer-reviewed publications on the outcomes of this diversion program. And so what this reflects is that we know that when diversion programs are implemented well, right? And that's probably the key, implemented well, they can have a positive impact on reducing the number of arrests of youth in schools without compromising school safety. And that students who complete and community-based diversion, when they're actually for behavior that's detected within schools, they're less likely to be suspended, they're less likely to be expelled or require other out-of-school transfers. And it actually prevents them from further penetration into the juvenile justice system. We also know that there are, some really interesting developing single session or short-term intervention models that are being described as trauma-informed that have a focus on supporting them and acknowledging mental health symptoms that would address the consequences of gun violence exposure. And one is called the VIP initiative. It's the Violence Intervention and Prevention Initiative. And this is brief interventions that are done in the community in what are called among OST programs. And OST stands for community-based out-of-school time programs as well. So this publication really offers up some recommendations for thinking about how to try to implement these sorts of programs. And none of these things are going to be too surprising to us, right? That these programs are likely to be successful when they foster and maintain community partnerships, when they think about implementing universal trauma screening and mental health screening in the OST program space, and that we need to not think about these as just traditional mental health programs, right? As they need to be sort of, staffed by mental health professionals, but the mental health professionals need to be seen as more consultants and collaborators with community members. And these community members should include other agency partners and parents and youth as co-collaborators in how to support the implementation of these brief trauma-informed interventions as well. And I think it just really prioritizes that idea of community participatory action research is critical in thinking about the successful implementation. I ran across, in preparation for this presentation, this really great article by Grant and colleagues talking about a program called Power Through Black Community and Unity. It's a real program model that's based on participatory action research and that focuses on defining what does it mean for a community to be resilient in the face of gun violence, right? And the resilience here was through the lens and perspective of Black youth themselves as well, which I thought was a really interesting, and it really highlighted 3 central themes that adolescents were identifying. The idea of collective care, that this isn't just one person's job, right, to address this problem. And a quote is recognizing is that we need to see beyond the bad, and recognizing is that even within communities that might be described as high burden communities and suffering from gun violence, that there are pockets of protective factors within the communities as well, and that it's critical to support community and teen spaces, right, as well. And finally, I won't reference this, but because of the school context, is if my school colleagues are not familiar with the Sandy Hook Promise program, I'd encourage you to take a look at this website. It is has a number of very, very interesting white papers that describe the context of um, known school violence and gun violence intervention reduction programs. Okay, I made it through, right? I'd like to just, conclude with uh, offering up a couple of highlights of some CTRJJ resources that I think that might be helpful for you. We started a trauma awareness and education series that we call Science and Services Spotlights. And so I'll give you a QR code for our website in a moment, but I encourage you. We developed these Science and Services Spotlights as brief downloadable free infographics on important trauma awareness and education topics that you can download and distribute within agencies, within your trainings, and more importantly to youth and families as well. And you will find one science and service spotlight that is specific to gun violence exposure that is accessible. I'd also like to just shout out and lift up a recent podcast that the CTRJJ launched called Roadmap for Change, Trauma Recovery and Juvenile Justice. This is a 12-episode topical podcast that and our third episode was just released this past week as well. And you'll see that there are some TBD topics that are yet to be released, and I'm encouraging one of those to focus on the gun violence problem as well. So I'm going to stop there, and I think I saved about 5 minutes, hopefully, for some questions, comments, or reflections. But if you'd like to subscribe to the podcast, look at those science and services spotlights or other resources through the CTRJJ, feel free to take a snap of that QR code, which will take you to what's called a linked tree and allow you to explore a number of our resources. Well, thank you so much for your kind attention here. I'll leave this up on the screen for a while, but I'm happy to entertain any sort of comments, questions, reflections on any of the information that I presented.
Thank you so much, Keith. There's a lot of chatter in the chat. I don't know if you can see it.
Oh, I don't actually have it up.
But that's okay. Yeah, no, lots of appreciation and gratitude for this really, really insightful and important presentation. There were a few comments in the chat. Did anyone want to pose a question or thought or reflection before I pull through the chat?
Yeah, Fong, this is Karen. I do have a question. Keith, thank you so much for a wonderful presentation, just chock full of so much. Very specific question. You mentioned that something about ethnic identity being a buffer, if I understood you correctly, against gun usage in some, and then the next slide or two sounded like there were lots of mitigating factors that would interfere with that potential protective factor. Could you just 30 seconds just kind of clarify that for me?
Yeah, and I think there's not enough consistent study here to really understand the consistency of these of risk and protective factors around ethnic identity. And I think, Karen, really where it sits is this idea, particularly in the ethnic identity model of centrality, the one that really one leans into their sense of their own ethnic identity as defining their emotional and behavioral awareness, is likely seen as being protective. And in at least a couple of studies that's been protective against gun carrying, right? As well. But unfortunately, I think though with that is in the context of being around negative other groups of adolescents that are all supportive or that carry guns themselves or are supporting within a particular peer network, supporting of an attitude that gun carrying is acceptable, a community norm, or as a sign of strength, right? Or respect. That may actually override, right? That protective sense that one may get from their own ethnic identity. And I think it's just important to recognize that these are possible avenues that we need to
Yeah.
think about in terms of risk and protective factors. But I just don't think that we know enough about who, for what youth, those factors become true buffering effects versus risk.
Thank you so much. Appreciate that.
Hi, Keith.
Yes,
My name is Desiree Neal. How you doing? First
I'm
of all,
good.
this was a wonderful presentation. So much valuable information. Not a webinar you sleep through, huh? Uh, I'm from Philly, and a provider, a grant manager for a grant that, offers grants to grassroots organizations providing programming for prevention of gun violence, and had never heard of the diversion program. And so it kind of hurt me a little bit because as opposed to an opportunity for a parent to keep their kid out of jail versus a more widely spread among providers base of knowledge. I just pulled up the annual report while you were talking, and yeah, the numbers are good, and the annual report is thumbs up, but it could have been so much more that could have been done if the diversion program was not just, okay, your kid's about to get locked up, but versus from a provider network, it was an option that we could have spread the word. So, but thank you for introducing me to that as a
Yeah.
provider. Thank you kindly.
And Desiree, you can feel free to reach out to me because you can find the reports, but I would be happy to connect you to the program evaluator of that school-based program if you'd like to get a virtual introduction. Fong, I would be remiss. I just didn't include this on the slide, but because this is also a developing area, and that I've become very, very interested in it as well. And there's just not enough good research here. But I think for those of us in school spaces or in juvenile justice spaces, there is growing attention to cyberbullying and the use of social media as being a proximal specific factor for adolescent violence and gun violence as well. And equally, too, I found a really interesting sort of almost TED Talk about sort of recognizing is that as opposed to taking away kids' phones and restricting their access, to this as well as actually thinking about how to try to leverage their digital use for positive messaging, right? Around, both education around gun violence, but really leaning into this as well. And I could tell you many, many cases where I've seen direct idiosyncratic, involvement of online beefs that then have resulted in gun violence as well. And so I think we have a lot of space to catch up to the kids in terms of their use of technology, but also recognizing that this is another potential risk and protective factor that we really need to consider.
Absolutely. Keith, just so much gratitude to you for taking time out of your busy schedule to drop some knowledge with us. I suspect maybe we may hope for another cross collaborative group conversation, maybe with you. Maybe like an extended Q&A, perhaps. There was just a lot of good nuggets that you provided. I did
Yeah,
let folks know in the chat that I'll email your slides and in the PDF
absolutely.
format. But there was a lot of gratitude for you in the chat, and I think this is all really giving a lot of us to think about in terms of, how we approach our work in school and juvenile justice. So
Yeah, thanks, Funk, for the invitation. As you can tell, is I'm very passionate about this work as well, and was just reflecting as I was sitting with a parent yesterday whose 16-year-old is at 14 years old. He had his other group of peers robbed him by gunpoint for his jacket. Within 24 hours later, he was a gang member. And 6 months later, he was arrested, charged with second-degree murder as involvement in a gang-related shooting. This is what we're up against, right? Within this context, and I have case after case that sort of fits this description. But it doesn't. We can't give up hope. right? We cannot give up hope that there are holistic, community-based efforts at prevention and intervention, to prevent kids, getting that deep, and that's what keeps me going. And I hope it keeps you all going as well. But thanks so much, Fong. And, if there's other follow-ups that we can have around this conversation, et cetera, I'd be more than happy to.
Yeah. Thank you. Absolutely. Thank you. And good luck at your conference in Puerto
Hey, thank you so much. Yes.
He's chiming in from Puerto Rico, so thank you.
Take care, everyone. Have a great day.